Thanks, Eric. Hello, everyone, and thank you to our Pharma for inviting me to present today. I'm Jesse Anderson. I'm a team lead in the Office of Computational Science and CDER at FDA, and I'm here to talk to you about our involvement on a CDISC and Fuse collaboration aimed at utilizing Dataset-JSON as an alternative transport format for submissions to regulatory agencies. So standard disclaimer slide, these views are my own and should not represent FDA advice or policy. And I would also like to acknowledge Sam Hume at CDISC, whose content I used for much of this presentation. So for the agenda today, we'll go through the pilot background, talk about executing the pilot, and why you should get involved. So first up, the pilot background. What is Dataset-JSON? So Dataset-JSON was created by CDISC to exchange tabular data using the JSON format to meet regulatory needs. There are several advantages. So it is an open source and truly human readable format. The schema supports any tabular format and eliminates the limitations of existing legacy formats. And the format's also extensible to support new metadata and new use cases, so it's expandable. So there are short-term and long-term goals for the pilot. In the short term, we hope to perform pilot submissions that show it is the same content, but in a different format and causes no disruption to business processes on either the industry or regulatory side. And FDA will evaluate internal tools to determine if we can support the JSON format. In the long term, we hope to evaluate how current and future standards can benefit without the XBT limitations. So this includes evaluating, combining the data with metadata and enhancing conformance rules. Concurrently, FDA will utilize the findings to evaluate their tool and redevelopment plan to natively consume files in the JSON format. The team's utilizing Fuse to help organize us with more information that's linked on this slide. It's broken up into 4 sub-teams, and each sub-team should be working together. And future reports will be developed for each sub-team and issued by next year's Fuse CSS, which will happen in Silver Spring in June. So this project is moving relatively fast. This is the overall pilot strategy, and our goal is to perform internal testing within organizations and provide feedback to the working groups. And there will also be an opportunity to send test submissions to CEDAR. Both the internal testing and test submissions will be complete by December 15th. And then so after these are complete, the Fuse working groups will evaluate the findings and release the reports. Moving on to the execution of the pilot. So there are several open source conversion software tools referenced on the slide. R is one of them. And we are certainly interested in learning more about participants' experience with it. There are other options, using Python and SAS, that will be available to use as part of this pilot as well. Additional information on each of these, along with links, are available in the appendix, and there are also testing instructions referenced on the bottom of the slide at the GitHub repository. So this is the high-level process overview. This is intended to be a short process, so you should be able to do all this testing, including providing feedback to the teams, in a day or less. That's the goal. We want to have as low a barrier as possible as low of a barrier to entry as possible and participate. And I want you to be able to participate in this pilot to maximize the feedback. So because the more feedback we have at the end of the day, the more prepared we will be for any issues that arise. You can select one or more software conversion tools to use and select the study data sets that you wish to use. And then you can convert them to and from the Dataset-JSON format and compare them to ensure there are no unexpected changes in the converted data sets. And there are additional optional test cases that you can complete before filling out the online questionnaire with your findings. So here are some sample conversion scenarios. The team's recommendation is to do at least one scenario, but if you can do more, that's great. Again, the intent here is to show that there is no difference in the data presented in either data set format. whether that be XBT or JSON. And here are some additional scenarios. So while these are optional, they would provide additional useful information for the teams to understand any limitations. And I should note that there is a known issue with the date formats between different tools, specifically R and SAS. And the teams are discussing potential solutions to this issue, and we welcome feedback and thoughts on this as well. So during September's Vue CSS in Silver Spring, there was a working session where participants came up with proposed elevator pitches for why industry should make this move. These business cases and elevator pitches were digested by the business case working group, and they came up with an elevator pitch, which is on the next slide. And the goal of this elevator pitch is, why should we get involved? And this is that elevator pitch. The take-home points to this pitch are: Dataset-JSON is more complete and accurate, it allows for greater efficiencies, and it will save time and money and is easily transferable between systems. So this was a crash course in this pilot. I would like to acknowledge the work of my co-leads, Sam Hume and Stuart Malcolm, on the CDISC and Vue sides. And if you're interested in participating, please go to the GitHub link on slide 10. I can also post it in the conference chat after this. And that will give you access to the testing deck, which will give you all the information you need to do in order to participate in the pilot. And if you are interested in submitting data sets to CEDAR after completing the internal testing, please reach out to me at the email address below. Thank you for your time and attention, and I am happy to take questions if there is still time to do so.
Well, thank you so much, Jesse. I know this has been an area that I think this is going to be immensely important as we think about more modern ways of sharing our results and capturing the rich nature of our data sets from both the standard clinical sets and now with the volume of data we're collecting in, say, device wearables and other biomarkers. I think this all is going to be an amazing effort for this.
Yep.
Very much. I'm scanning for questions. I don't really see any immediately, but again, you've already given us some key links for people to get involved, and certainly, yeah, I can vouch. You're about to hear in a minute here of how awesome the collaboration can be with the regulators on these novel initiatives. We've learned so much, and I think this is going to be another one of those opportunities.
Absolutely. And we look forward to it as well. So.